Hello and welcome back to part 2 of our exploration of thyroid disorders, where we're going to basically fill out the other half of this table. And we're going to look at the findings and treatment of hypothyroidism. So the nice thing about hypo, it's going to be the opposite for the most part of hyperthyroid disorders. So let's follow the logic once again. You have, with hypothyroidism, you have decreased T3 and T4. You have decreased T3 and T4 levels. Okay. Because your metabolism is not burning fuel as efficiently, you would expect to see weight gain rather than weight loss. And again, you might see a decrease in your vital signs. So you might see a decreased blood pressure, a decreased heart rate, and possibly decreased respiratory rate. Much like the person who's hyper and can't tolerate heat, the person who's hypo is going to tend to always be cold, and they're going to have cold intolerance. While the person with hyper is flushed and sweaty, the person with hypothyroidism tends to have dry skin. Another typed hypothyroid, dry skin. The nails, the fingernail, or the hair, sorry. The hair for the person for hypothyroidism, you're more likely to see hair loss. And the nails for someone who's hypothyroid, you're likely to see brittle nails. Moving further down, as far as the eyes, you're not going to have an exophthalmos. But when you start thinking about myxedema can either be like congenital untreated hypothyroidism, or it can become a hypothyroid emergency, but you may see edema of the eyelids. You also might see a goiter. So the patient with hypothyroidism may have a goiter. And the reason for this is that you have excessive, usually you have excessive TSH. So sometimes you can just have a hypertrophy of the thyroid gland for both excessive production, but also if you have excessive TSH stimulation, you can have a goiter. So goiter can be either. It can be either hyper or hypothyroidism. As far as bowel function goes, we go to the opposite end of the spectrum, and the person with hypothyroidism is more likely to develop constipation. As expected, somebody who is hypothyroid, is more likely to have low energy, and they are sleepy. Cognition-wise, there's something called brain fog. So brain fog, it's kind of what you think. The patient feels foggy, they have difficulty concentrating. And I can tell you anecdotally, my friend who has Hashimoto's thyroiditis, which is an autoimmune form of hypothyroid, she struggles with brain fog a lot. So it is something that I can tell you anecdotally, I have heard people say that they can get brain fog from the hypothyroidism. As far as mood and affect, somebody with hypothyroid is much more likely to be depressed. As far as female or menses issues, you can have a lot of different things with hypothyroidism. You may have amenorrhea, which I can't spell at the moment. You can have heavier periods, or you may have missed periods. So you can have a lot of different signs and symptoms. It's usually not a diagnostic criteria. Most often, patients with hypothyroid are going to present with weight gain, feeling tired, constipation, brain fog. Those are the most common things, and some of these other things you may see. So let's talk about treatment of this disorder. Okay, this by far, by and large, is the more common of the thyroid disorders. And the other thing about an endocrine disorder, when you have a deficiency, you give it back. So we're going to give back thyroid hormone to the patient with hypothyroidism. And that's in the form of levothyroxine. Okay, I believe the brand name is Synthroid. Okay, so it's a replacement thyroid hormone. And there are rules to taking thyroid hormone. Okay, you need to take in the morning. Okay, empty stomach. Okay, ideally same time every day. And you would expect to monitor the T3 and T4 regularly. Because with any of these disorders, so let's say that I do take levothyroxine. So let's say that I take an extra levothyroxine because I feel like maybe my metabolism is slowing down some more. Well, I run the risk of putting myself into a hyperthyroid state. So either if I have hyperthyroid and I'm trying to suppress it, or if I have hypothyroidism and I'm giving thyroid hormone, too much, you run the risk of having the opposite problem. So somebody who is hypothyroid and maybe is taking their thyroid hormone and they're taking an extra one, it might put them at risk for developing hyperthyroid. Excuse me. Emergent conditions. Okay, the emergency that they talk about is myxedema or myxedema. I say myxedema because that's what it looks like to me. Myxedema coma. Okay, and it's an acute hypothyroid state. So, for example, someone is on thyroid hormone and they just stop taking it. Okay, and so it puts them into a profound or an acute hypothyroid state. And this patient is going to have a decreased LOC, so decreased level of consciousness. Okay, they're going to be hypotensive. They're going to be hypothermic. And they're probably going to be bradycardic. Okay. Patient needs to be on, even though you're less likely to have seizures, I have seizure precautions written here, so okay, patient needs to be on seizure precautions either way, although you're much more likely to see it with the other side of things. And you're going to treat the acute hypothyroid state with IV levothyroxine, as well as for the hypotension, probably first you're going to treat with isotonic fluids. Because remember, if the patient is unstable, you treat the instability first, and then you dig for the cause. So on the thyroid storm side of things, you have an unstable patient. Okay, we're going to stabilize the patient with IV beta blockers and a cooling blanket, and then deal with the antithyroid meds. Over on the myxedema side, I have a patient who's hypotensive and hypothermic and bradycardic. Okay, so I need to support that patient. So my thoughts are to increase the blood pressure by providing isotonic fluids. Okay, and I can give IV levothyroxine, which will hopefully help to reverse that state. Okay. And over here on the autoimmune form, it's Hashimoto's thyroiditis. That's the autoimmune form of hypothyroidism. Okay. So a common visual that people refer to with this is hyperthyroidism is Tigger. So if you're familiar with Winnie the Pooh, Tigger obviously moving constantly, busy. Whereas hypothyroidism is Eeyore. He's kind of big, he's kind of slow, and he's depressed. So that's another visual that may help you to envision what these look like or how these look like. So I hope that you enjoyed this short visit through thyroid disorders. Thank you for your time and attention, and you have a good afternoon or evening or day. Thanks.